Hi, my name is Emily Kempfer, and I completed my internship at Coastal Horizons and Wilmington Health Access for Teen, which is also known as the What Clinic. Coastal Horizons' mission is to improve the health of our youth of our community, ages 6 to 24, by ensuring access for all to quality physical and mental health services, and by providing prevention, education, and outreach services to promote optimal health. The What Clinic addresses and minimizes barriers to health access for adolescents and young adults while linking them to a medical home. The way that Coastal Horizons is run, there is one medical director, Dr. Jennifer Nomides. She is an MD and also has a master's in public health, and she oversees all of the healthcare providers, which include physicians, physician assistants, nurse practitioners, and licensed therapists, and these all provide services to the patients. Some services that Coastal Horizons provide is mental health counseling, vaccinations and immunizations, wellness physicals, laboratory testing, treatment for acute and chronic disease such as asthma and diabetes, substance abuse screening, and referrals for non-medical services. Coastal Horizons is a nonprofit service, so it is funded by public and private sources of funding, including grants and community support through individual and corporate donations, as well as patient reimbursements. So grant funds account for 55% of the organization's revenue, patient reimbursements account for 43%, and corporate and individual support is at 2%. As an intern at Coastal Horizons, my internship project was my main responsibility. My site supervisor and I decided that if I created and implemented a survey for the agency, this would be the most beneficial for them. So my project ended up being a survey that included 6 questions that provided the necessary feedback from patients at the agency so that telehealth patient satisfaction could be improved throughout the agency. I created this 6-question survey and then I submitted it to the IRB so that they could deem it exempt from IRB approval. I began with downloading the patient database from Coastal Horizons onto my computer, and then my site supervisor walked me through how to use it, and I used 2 providers within Coastal Horizons and contacted their patients that they have appointments with. I used Google Voice to call them, and I would ask if they were willing to do a patient satisfaction survey for me. So in total, I called 131 patients, and I had 52 patients complete the survey. So overall, I did get very good feedback from the patients, and most of them seemed very satisfied. So overall, 80.8% of patients were able to easily connect with their provider, and 90.4% of patients did not have any issues throughout the meeting, and 67.7% of patients would like telehealth appointments to continue to be an option in the future. When I collected this data, I analyzed it afterward. To do this, I looked at common themes or trends to the answered survey questions. So I looked for keywords that were mentioned within each survey. These keywords were Wi-Fi, Zoom, personable, service, environment, comfortable, video, convenient, and volume. And after finding these keywords, I looked to see what type of connotation they were used in, whether it was positive, negative, or indifferent. Then I grouped these keywords into their respective categories, and I was able to identify 3 main trends that patients and their parents had mentioned. So first off, most patients use Zoom for their appointments, and for those that did not have good Wi-Fi connection or service, a phone call or FaceTime to their mobile number worked much better than trying to Zoom. It was difficult for many patients to get both the video and audio on Zoom to work. The second trend that I identified was that telehealth appointments were not as personable. This was probably the most the biggest negative and downside to telehealth appointments and the biggest complaint that I got. They stated that the relationship between the provider and patient was not as great, and parents thought that the provider wasn't able to provide as good a service as in person. The third trend that I determined and was probably the biggest positive of telehealth appointments was the convenience of it. Many parents and guardians liked that their child would be in the comfort of their own environment, and the parents themselves didn't have to worry about who's driving there, the travel time, or being on time. But overall, after the evaluation of the data, it's been a good indicator that Coastal Horizon patients are satisfied and would like the option to continue using telehealth in the future. So moving on to the public health domains that I addressed during this internship, I think this project especially helped me with the role and importance of data in public health. I was able to more thoroughly understand the basic concepts and methods of data collection, basic tools of data collection, data usage, and data analysis. This project also aligned with project implementation and intro to evaluation concepts. I was able to create this survey and implement it, which gave me great experience. And my internship project also aligned with introduction to processes and approaches to identify needs and concerns of populations. So overall, I believe this survey will be very beneficial to Coastal Horizons. It will provide them with the necessary data they need to move forward with telehealth appointments and allow further patients to have their voice heard. Moving on to my most important learning objectives and experiences, I think for me personally, the most important learning that took place for me was having to go through the IRB and submit my survey for them to look at. We talked about IRB approval a lot in classes, but actually having to go through the process made me understand it a lot better and what the point of it really is. The thing I liked the most about my internship was how flexible my site supervisor was. He really gave me the autonomy to do whatever I wanted as long as it was useful to the agency, and he listened to my feedback and thought if I had an idea and he thought it would be beneficial to them, he would let me do it. So this really made me enjoy my internship a lot more. It made me really excited to complete my project. I think my least favorite part of the internship was probably at the beginning. I've never really liked calling people, and having to cold call them was really nerve-wracking at first, but I was able to overcome it, and I ended up actually becoming really confident by the end of the summer making those phone calls. And my most memorable experiences were probably just hearing the positive feedback from patients and their parents. I had two people specifically that were just really extremely grateful for telehealth and the opportunity to be able to use that, and they had so many positive things to say. So I really enjoyed talking to those two because they really brightened up my day. So overall, my intern experience at Coastal Horizons was a great time, and I really enjoyed being able to work with them, and I'm really excited for the opportunities to come.